So good afternoon, everyone. Hope everyone is having a wonderful day. Welcome to the 5th session in the Center for Environmental Health webinar, Maternal and Child Health webinar series. So great to see so many of you guys back here again today. We're now going to go ahead and begin. So we at the Center for Environmental Health focus on the protection of families and communities from toxic chemicals. And in this series, we have been focusing on unconventional natural gas development and extraction, otherwise known as fracking, and exploring the potential health impacts for women of childbearing age, pregnant women, and infants and children. We are really excited and pleased today to have with us Dr. Sheila Bushkin-Bedian. Dr. Bushkin-Bedian is a public health physician and a member of the Institute of Health and the Environment at the State University at Albany, as well as a member of the Concerned Health Professionals of New York. She has also been a member of the Medical Society of the State of New York for more than 15 years. And is currently the Vice Chair of the Medical Society of the State of New York's Committee on Preventive Medicine and Family Health. Dr. Bushkin will be speaking today on toxins and their link to metabolic disorders and chronic diseases. She will describe the prenatal origins of disease and why it is important to investigate possible connections between unconventional natural gas extraction and diabetes, obesity, and cancer. Dr. Bushkin has become a dedicated advocate for the advancement of public health and preventive medicine. Her specific areas of interest involve environmental health issues, obesity, chronic diseases, health concerns of older adults, as well as environmental-related developmental issues affecting children and adolescents. She also works to provide high-quality continuing medical education for physicians and other healthcare providers as a member of the Medical Society of the State of New York's CME committee. She has served on numerous committees dealing with public health education and advocacy. In addition, she has authored and co-authored and lectured extensively on a wide range of environmental health issues, including exposure to chemical contaminants and ionizing radiation in early childhood associated with cancer later in life, the public health risks associated with hydraulic fracturing, the health risks and benefits of consuming fish from contaminated waters, chronic diseases affecting pediatric and adult populations, childhood obesity and nutrition, influenza and pandemics, emerging infectious diseases, bioterrorism, disaster preparedness, and the mental health impact of disasters. Her advocacy activities have included several written and oral testimonies, including the health impacts of unconventional shale gas operations and radon to the New York State Legislature in 2013 and 2014. And she was also on the New York State Governor's Panel in November 2012. So Dr. Bushkin-Bedian, thanks so much for being with us here today. We're really excited to let you begin, so I'm now going to turn over and let you begin your presentation.
Thank you very much, Ellen. And welcome to all of you, and thank you very much for joining us today. I hope you find this educational and interesting. Today we are going to speak about environmental toxins in perinatal and early life development and the link to cancer and metabolic diseases later in life. I have no relevant financial disclosures to make. This webinar was produced with no outside funding. The educational objectives for this webinar are to understand the concept of developmental origins of health and disease, to learn about the pathophysiologic processes in humans caused by chemical contaminants associated with unconventional shale gas operations, otherwise referred to as fracking, to understand the role of toxins in carcinogenesis, and to understand how chronic metabolic diseases result from epigenetic and physiologic changes that occur due to early exposure to chemical toxins. I'd like to talk about the fetal origins of chronic disease, which really begin with David Barker in the early 1990s. He observed that poor maternal nutritional environment resulted in intrauterine growth restriction and the delivery of low birth weight infants. This was linked to chronic diseases developing in these individuals later on in life, including coronary heart disease, diabetes type 2, hypertension, and stroke. The theory received a lot of attention and further study, and today much epidemiological and experimental evidence exists which supports an expansion of these theories called the developmental origins of health and disease. The expanded theory includes developmental susceptibility throughout all the stages of growth and development, from prenatal to childhood to adolescence, and not only to just poor nutritional issues, but also to intrauterine and childhood exposures to environmental toxic substances, such as chemicals called endocrine disrupting chemicals, or carcinogens, mutagens, immunosuppressors, and many more. Part 1 of my talk is going to be about exposure to environmental chemicals during gestation. There is irrefutable evidence of exposure to environmental chemical sources, which comes from the findings of more than 100 or even 200 chemical toxins found in the umbilical cord blood of newborn infants in studies performed by the Environmental Working Group, both in 2005 and 2011, and by many other studies. Similar research provides evidence of toxins in the meconium and amniotic fluid, and this is also, especially the meconium, of special concern because it indicates that the toxins actually entered the baby's ingestion and traveled through his body. So there is a body burden of chemical contaminants in humans and animals today, and in the ecosystem in which we live, because we are continually exposed to toxins in the air we breathe, the water we drink, the food we eat, the personal care products and household products that we use. Exposure begins during prenatal development. Many of the chemicals have long half-lives and are poorly metabolized and excreted, so they are persistent and accumulative in our bodies. Therefore, they are already present in maternal tissues. And when the young woman of reproductive age is ready to become a mother, many of these toxins are able to cross the placental barrier, where they expose the developing fetus during one of the most sensitive periods of development. There are potential effects of complex mixtures of toxins. And ordinarily, when we study toxins, we discuss and study the results of exposure to one particular toxin. But toxins don't work that way. As part of a complex mixture of chemical contaminants, these toxins may cause more tissue damage than they would during isolated exposures because they act additively or synergistically to potentiate the actions of the other toxins present. The complex mixture of toxins may include new toxins to which the mother is currently being exposed, such as fracking-related chemicals, as well as other contaminants which are already stored in her body as part of her existing body burden of chemicals. Furthermore, legacy chemicals, which have already been banned since the 1970s, such as PCBs, dioxins, persistent organic pollutants, and pesticides, are still present in the ecosystem because of their long half-lives, and they will continue to contribute to the mother's current daily overall exposure to the complex mixture of toxins in the air she breathes, the water she drinks, and the food she consumes. Now this slide is about adding insult to injury, or adding unconventional shale gas toxins on top of all the the toxins to which we have already been introduced. We admit that there are many unknowns about long-term health effects caused by recently introduced fracking toxins. Horizontal fracking, with its immense amounts of chemicals and waters, really only began in about 2005, so its history is rather short. But much is already known about the long-term health hazards of many historical environmental toxins linked to irreversible chronic diseases such as obesity, diabetes, and cancer, and already existing among many generations of the American population and many subpopulations such as native populations and indigenous people. After decades of experience with endocrine disrupting chemicals and known carcinogens, it's reasonable to predict what kind of diseases may result from further environmental insults from fracking-related toxins. Well, one fracking-related toxin that I'm going to start out talking about is arsenic. Arsenic is usually thought of as a carcinogen because it does have a role in causing lung cancer, bladder cancer, and other cancers. But it is also an endocrine disruptor, and as such, it affects multiple steroid receptors in the hormonal system. Actually, it affects all 5 steroid receptors, including the glucocorticoid receptor, the mineralocorticoid receptor, progesterone, androgen, and estrogen receptors. It also affects the retinoic acid receptor and also thyroid hormone receptor. And it has significant effects as an endocrine disruptor at very low doses. In addition, it is likely that a common metabolic pathway is central to the effects on all 5 steroid receptors, but we don't yet know, or we don't understand very well, what this common metabolic pathway is. And so while researchers today are actively pursuing answers to explain the deleterious effects of toxins associated with the fracking process, there are still lessons to be learned from past exposures that may expedite our understanding of future health threats from new, often chronic, low-dose daily exposures. Now I'd like to talk about the famous BTECs, 4 endocrine disruptors that are associated with unconventional shale gas operations. And this was a study that was done in 2002 by Reutemann et al. The study was done on women who were employed at the U.S. Air Force. They were of childbearing age, 18 to 42, and they were studied to see if the fuels and solvents to which they were exposed, such as benzene, toluene, ethylbenzene, and xylenes, from jet fuel, JP8, could have adverse reproductive effects. It was known that pharmacokinetic modeling revealed that women metabolized 23 to 26% more benzene than men under the same exposure conditions. So they studied endocrine endpoints at 4 times during the ovulatory cycle, using urinary levels and breath levels also for the selected endocrine markers, which were pre-ovulatory luteinizing hormone, follicular pregnenolone 3-glucuronide, mid-luteal pregnenolone 3-glucuronide, and mid-luteal estrone 3-glucuronide. Their findings were that exposure to hydrocarbons from this fuel and from these chemicals lowered the pre-ovulatory luteinizing hormone levels in this exposed population, and signifying that chronic exposure to these hydrocarbons could compromise reproduction. A recent study came out in December of 2013 that studied water samples taken from the Colorado near high-density region for fracking operations. And they found chemicals that were linked with estrogenic activity as agonists, like bisphenol A. They found chemicals that were anti-estrogenic activity, such as 2-ethyl-1-hexanol and ethylene glycol. And they also found chemicals that were linked with anti-androgen activity. That was also ethylene glycol and N-dimethylformamide and cumene. Well, there are alarming trends today in obesity, diabetes, and metabolic syndrome. In just a single generation, weights have become very excessively high, with a large part of the population, at least 30% or more, being overweight, which is a BMI over 30, and obese, which is a BMI over 35. One of the most alarming trends in metabolic disease today is the obesity epidemic and the rising incidence and prevalence of diabetes type 2, which may accompany it, and also their comorbidities, which include hypertension, hypertriglyceridemia, and heart disease. These diseases are now common among children and adolescents, as well as adults. Even young infants today are beginning to demonstrate evidence of obesity. And this cannot be based just on the fact that they are overeating or under-exercising. Much speculation concerns the underlying cause of the rapidly expanding obesity problem, which is widespread throughout the United States population and in other developed nations as well. And let's talk about the effect of prenatal exposure to endocrine disruptors on lipid metabolism. There are multiple substances that have an effect. Various pharmaceutical agents and environmental chemicals can influence the process of adipocyte differentiation and lipid storage. Among the environmental chemicals, several endocrine disruptors, called obesogens, feature prominently as likely culprits. These endocrine disruptors have been deposited in our environment for decades and are now an integral part of our lives. They interfere with hormonal processes that regulate lipid homeostasis by disturbing gene expression and signaling pathways. Obesogens are believed to be one of several factors which can provide epigenetic influences over gene expression. Thus, they can influence the differentiation of multipotent mesenchymal stem cells into preadipocytes rather than osteoblasts. In that way, they can promote the production of increased numbers of fat cells very early in life, so that babies are born with these increased numbers of fat cells. We call this adipose hyperplasia. They can also influence lipid storage, resulting in enlargement of individual fat cells, and we call that adipose hypertrophy. They can also influence the hormones that control hunger and satiety. Here's a chart that just shows you the way in which differentiation can occur from multipotent stem cells. Multipotent stem cells are not the same as totipotent, in that they cannot develop into just any kind of cell. By the time they become multipotent mesenchymal stem cells, usually in the fetal stage, which is about 8 to 10 weeks, they generally have a designated course, but it still can go one way or the other. In this case, there is a control system called PPAR-gamma, which encourages the multipotent mesenchymal stem cell to develop into a pre-adipocyte. The pathways located here are not well understood as yet. In addition to that, once they have already been committed to being a pre-adipocyte, they can then go on to become adipocytes. Factors governing normal adipogenesis and osteogenesis from mesenchymal stem cells. This is a review of the slide you just saw. Multipotent mesenchymal stem cells can differentiate into a number of cell types, including adipocytes and osteoblasts. The transcriptional coactivator TAZ negatively regulates adipogenesis, and it promotes osteogenesis by suppressing PPAR gamma. But the overexpression of PPAR gamma can reduce bone formation and promote adipogenesis. In the gestational environment, and here you see a fetus in the second trimester, this is the point at which the embryo becomes a fetus by the end of the 8th week by embryonic age and the 10th week by gestational age. The fetal mesenchymal stem cells are multipotent, as we already described, and can divide into adipocytes and osteoblasts. Various factors influence the commitment of the mesenchymal stem cells into a preadipocyte, as we already discussed. Oops, sorry. Pre-programming of adipocytes is important in the adipogenesis, and obesogens are thought to pre-program the adipocytes of the fetus such that he or she is destined to become obese and or diabetic later in life. And if that is the case, then this person will have a very difficult time trying to change his obese status, regardless of how much dieting and exercise he does, because he may already have a set point predetermined by obesogens, and that would have occurred during early development. Of course, there are other pathways that contribute to the early programming of adipocytes, including glucocorticosteroids, usually from maternal stress, nutrient abundance during fetal development, and also intrauterine growth restriction followed by a catch-up period postnatally. And here in third trimester, this is when the adipose depots are first beginning to be laid down. And if you look at the picture of this fetus, you can see that he's already filling out. His arms and legs have a little more subcutaneous fat that makes him look a little bit more like a baby ready to be born. This is a chart that is very interesting and very important, but it generally relates to critical periods of development for physical changes and not so much metabolic. I just thought it would be interesting for you to see this and to see that through the entire pathway through gestation, babies are embryos and fetuses are susceptible to many changes that affect the CNS system, the heart, the limbs, facial development in the upper lip, ears, eyes, and so on. Can you see my slides well right now? Because I'm getting some pop-ups that are indicating to me that there is some difficulty. Are you able to see my slides?
Yes, I believe we can.
Okay, good.
Attendees, if you cannot, just write in the chat box that you cannot. All right, thanks. Bye.
In prepuberty and adolescence, my goodness, in prepuberty and adolescence, the ovaries and the testes are developing, and primordial stem cells are at great risk if exposed to chemical contaminants and radioactive materials. Now we're going to move on to part 2, in which we discuss certain ionizing radiation effects. Ionizing radiation is a known carcinogen. There are multiple types: alpha particles, beta particles, gamma and X-rays, and neutrons. And we're going to focus on the alpha today. You can see that the alpha particles really can't even penetrate paper, so that makes you think that they're not really very dangerous. However, they are part of what radon and its progeny emit. So what is radon and what are its progeny? Radon is a radioactive gas. It's colorless, odorless, invisible. I've shown you this little picture here because by placing it through a small gold tube and putting it in the presence of zinc sulfide phosphor, it's able to do something called radioluminescence. It's ubiquitous, radon and its progeny, due to the fact that it's in soil, rock, and in groundwater everywhere. It has a half-life of 3.8 days, and it decays, goes through a decay pathway, and doesn't decay into nothingness. It decays into other radioactive substances, which are called the progeny or the daughters. Alpha decay particles are emitted by this invisible radon gas. Alpha particles are a highly ionizing form of radiation, and when inhaled or ingested can cause considerable biologic damage. Otherwise, it does not pass through the skin or cause burns on the skin. Radon and its progeny have short half-lives, so they emit alpha particles very actively. The delicate lining of the lungs gets bombarded with the rapid emission of alpha particles, and that leads to tissue inflammation and later to damage. And tissue damage can lead to DNA damage. What is the main source of radon? Well, radon in itself is a breakdown product, and it comes down from radium, which is a breakdown product of uranium and thorium. Uranium and thorium are part of the Earth's bedrock and have been there since the Earth was created. They have very slow half-lives, billions of years, and they decay down to radium, eventually to radon. And that's why radon is found naturally, normally occurring in rocks and soil and in groundwater. Here's a picture of the decay chain, starting with uranium, which has a half-life of 4,500,000,000,000 years. That's its half-life, so it's going to be around forever. It breaks down to radium, which has a half-life of over 1,600 years, so that's going to be around forever too, at least as far as forever is for us. Radium breaks down to radon, and that has a relatively short half-life of 3.8 days. Now you can see that radon breaks down in its own little stepwise pathway, and it breaks down to something called polonium, also to lead, and also to bismuth. Polonium is radioactive. Polonium-210 is deadly. It's actually much more pathogenic than radon itself. And the only non-radioactive material that it leads to eventually is a stable nuclide, and that is lead-206. I'm showing you this chart here, maps, to compare the maps of location of Marcellus shale distribution and where there's very high density of radon potential. In other words, where the radon concentrations are very high. In this map over here, which is kind of a more decent map, you can see Pennsylvania very nicely. And you can see a kind of hazy beige or peach colored region. That is the Marcellus Shale, and it extends into Ohio, West Virginia, a little bit into Maryland, and this part up here belongs to the southern tier of New York, and it underlies also the central counties of New York. So New York, and you can see in this map, which is a little bit off kilter, I just couldn't rotate it adequately, but here's Pennsylvania, and here's the southern border of New York. The pink color indicates the very high concentration of radon. And this radon, we actually see this reflected in the amount of picocuries of naturally occurring radiation that comes up through the cracks in these counties in the southern tier and in the central states. In the northern regions of New York and down here in the southern regions of New York, Long Island, and the city, New York City, there is low levels of radon, pretty much acceptable levels as far as EPA is concerned of 1.3. Even though the EPA does confess that there is no safe level, they feel that at 1.3 they can't recommend mitigation at that point. And the same is true of the northeastern part of New York State. But in the region of the southern tier and the central counties of New York, the radon actually can be as high as as 6, 8, 10, even 14.8 picocuries per liter in Cortland County, and that's according to a map that was found on the New York State Department of Health website. So under normal conditions, how does radon enter a house? Well, through the cracks in bedrock, through the soil, and through cracks in the foundation of your house. It can get into well water, it can get into fittings of pipes, and it can travel in water. Radon is a gas, and the minute it comes out of the shower head or other sink faucet, it will immediately enter the air because it is a gas and it won't stay in the water state. Radon can also come into your house not naturally, but sort of delivered intentionally, along with natural gas for appliances that use natural gas, like gas stoves, gas heaters, gas fireplaces, and it also emanates from exhaust fans and clothes dryers, kitchens, bathrooms, and also in builders' material, including drywall and even granite. Most common route of exposure for inhalation for radon and its progeny is through inhalation. And you can see in this picture, this diagram, that this individual is breathing in these little particles. These little particles are actually attached to radon progeny, mostly polonium, because polonium is actually a solid with an electric charge that adheres to these dust particles. It can then drop down through the trachea and into the bronchi and into the bronchioles and into the lungs. Inhalation of radon and its progeny can cause lung cancer, and here's a diagram which shows how rapidly it can metastasize via lymphatics. This white area over here is actually the tumor that has developed. And close by, attached to these branching bronchioles, you can see lymph nodes. These lymph nodes have already been infected by the disease, by cancer. You can see the normal lymph nodes on this side are kind of white, and here they're kind of a gray. From here, they can very easily metastasize to the brain and to other sites. There is a synergistic effect between radon, its progeny, and tobacco smoke. Cigarette smoking is the leading cause of lung cancer deaths per year. Approximately 90% of all lung cancer deaths, and that's more than 160,000 people each year. Radon and its progeny are the second leading cause of lung cancer deaths per year, and they are also the leading cause of lung cancer deaths among non-smokers. About 2,300 non-smokers die each year from lung cancer, mostly from radon or a combination of radon and secondhand smoke. If someone is exposed to radon and is also a cigarette smoker, the risk is almost 10 times higher for lung cancer. And as I already mentioned, secondary smokers, passive smokers, are also at a greater risk. And did you know that another source of polonium is in cigarettes themselves? This is because the tobacco plants take up radioactive material through soil and fertilizer, and fertilizer is also deposited on the leaves, especially fertilizer containing phosphorus, and it's not able to be cleaned off adequately, and so it actually winds up on the tobacco, which is rolled into the cigarettes. The main health threat from exposure to radon and its progeny is lung cancer. This is a very bad disease. It is the most common cause of cancer deaths in men and women, more so than prostate, breast, or colon cancer. Approximately 50% of patients die within 1 year of diagnosis after tremendous suffering. The 5-year survival rate is very dismal. It is the lowest among all cancers, approximately 16% 5-year survival rate. Let's talk about how carcinogenesis is related to radiation exposure. And carcinogenesis, of course, is how cancers develop. So we have the alpha particles, which we know cause DNA damage by bombarding the very delicate pulmonary tissues. If natural DNA repair mechanisms are ineffective for some reason, a mutation that has occurred will be allowed to remain within a viable cell. Subsequent cell proliferation will multiply that mutation in the cell line. Inborn processes such as tumor suppressor genes and tumor promoter genes regulate whether a cell with damaged DNA can survive and proliferate, or if it will be removed by apoptosis, which is programmed cell death. Proliferation of mutated cells obviously leads to tumor growth. Now, mutagens are chemicals that can actually cause mutations in the cellular DNA. But no single mutation leads to tumor development. Additional so-called hits to the genes are needed for carcinogenesis to proceed and occur throughout the life of the individual. Other chemicals called carcinogens may or may not be mutagens, and even if they're not mutagens, they actually work to support the progression of the carcinogenic process. Other factors are also involved: epigenetics, individual resiliency, immune status, and other mutations that occur throughout the life of the person. Long latency periods between exposure and tumor development are characteristic of cancers, and they cause some confusion about causality, because it is hard to know whether certain exposures that a person had 20 or 30 years ago is really the reason for why he has a cancer today. Children are the most vulnerable population. Greater exposure occurs because of to inhalational agents because children have a faster respiratory rate than adults do per kilogram of body weight. They may not yet have a well enough developed immune systems. Children, especially small ones, are very close to the floor, where radon progeny particles settle, like, for example, polonium, and therefore they have a greater concentration of polonium within the air around their face. And they have more hand-to-mouth activity, so that they pick up whatever dust has settled on the ground, chew on their fingers, and they can ingest polonium in that way as well. Children also have many more years, hopefully, of future life, but unfortunately, that also gives them greater opportunity for a cancer with a long latency period to develop. If an individual has been exposed to mutagens or carcinogens during fetal development, he has received his first hit during one of the most sensitive periods of fetal development. The EPA estimates that for deaths due to radon, it's approximately 21,000 people per year. And you remember before I mentioned that 2,300 die just from radon alone without smoking. So the rest of this very large number is made up of the combination of radon and other factors like smoking. It's even higher than the number of deaths from drunk driving, from falls in the house, from drownings, and from home fires. People can check for radon gas in their homes, and generally these do-it-yourself tests are done in the basement to determine whether naturally occurring radioactivity is entering into their basements. It's advised that a person who's interested in knowing whether he has radon in the house should contact either his Chamber of Commerce or his town clerk to get recommendations for local contractors who are trained in this. It's important to note that if you do the testing for radon in your basement, you will not be detecting the radon that is coming through your kitchen appliances especially if they are gas appliances. And so new standards are beginning to be developed now in order to test for radon in the kitchen to see whether or not high levels of radon are found there as well. For additional information on radon, you can contact the New York State Department of Health Bureau for Environmental Radiation, and the information is here, and we can get that to you later if you're interested. And we also have their website. As far as radon mitigation goes, the EPA standard is this. They say that you should undertake corrective measures if the radon levels are between 2 and 4 picocuries per liter in indoor air in your house. They say that it can't be lowered below 1.3 or 1.5. But they also say that there is no safe level of radon. Now, what's important about this is that if your house has a background level of naturally occurring radon, when you then go and have fracked gas coming in, natural gas coming in from the Marcellus region, that fracked gas will be carrying high concentrations of radon, and this radon is called T-norm. T-norm means technologically enhanced, and it's more concentrated than the natural radon that comes up through your basement. And so the point is that you're going to have some norm from your basement, and now you're going to be having additional T-norm radon coming in with your natural gas. And that's going to add on top of your background levels of radon. And that's going to subject people to higher levels of radon. There are some approaches to mitigation, such as mechanical ventilation systems, and different approaches are used based on foundation types, whether you have a basement, a crawl space, or a slab on grade. In summary, there will be increased delivery of natural gas to New York State homes, which will be bringing with it increased levels of radon. And this is a serious public health concern, because it will increase the levels of indoor radon and its progeny above background levels. It will increase exposure of New York State residents to radon and its progeny. It will increase the risk of lung cancer among New York State residents, whether they smoke or not. And it will increase the risk of eventual cancer among vulnerable populations, including especially children, but also elderly people and patients with immunosuppressed health status, people with existing chronic pulmonary diseases, people with other chemical exposures such as arsenic, asbestos, direct tobacco smoke, and environmental tobacco smoke, which we call secondhand smoke. Thank you very much for being an attentive audience, and if you have any questions, I'll be very happy to take them right now. Thank you.
Thank you, Dr. Bushkin. Thank you so much. You really covered a lot of ground with that, and I'm sure I'm certainly appreciative of that. I'm sure the attendees are as well. I think it was also really good that you pointed out that although there is much that we still need to study and come to understand through research about the potential health connections between hydraulic fracturing, that we already know quite a bit about the long-term health hazards of many historical environmental toxins. So thank you for covering that. So we'll now open up the session for questions. Please go ahead and type your questions into the chat box on the GoToWebinar panel, and we'll go ahead and begin. So Dr. Bushkin, we have your first question here, and the question is, can you please give some examples of chemicals that act as obesogens?
Yes. Now these are older chemicals, and they are not they're not associated with radon. With fracking. So the prototype of obesogens is an endocrine disruptor called tributyltin. It's from the family of organotins. It was used widely for about 40 years in the 1950s. And then it was banned in the 1990s. It was used as a biocide, and it was used in paint. It was combined with paint that was used on the hull of ships and boats so as to prevent things like barnacles from attaching. The problem is that even though it was banned in the 1990s, it's still in use in countries like in the Caribbean where they don't have regulatory controls or enforcement that's very satisfactory. Well, this biocide, this organotin, leached out into the water, affecting many sea mammals like sea otters, dolphins, and also fish like tuna, and actually wound up in tuna fish, in canned tuna fish, as part of the human food supply. So now people have tributyltin in their own bodies as part of our body burden today. It's still there. It's still in the ecology, in the ecosystem, and it has a half-life. It has a half-life of about 2 years, but it will continue to be in the environment for approximately 30 years more if it's stopped being used illegally. In addition, there's also diethylstilbestrol, which was actually a pharmaceutical agent that was actually prescribed to women. It's a synthetic estrogen, and it was prescribed during the 1950s through 70s. And it was known to cause a very, very unusual and rare type of vaginal cancer. So in addition to being a carcinogen, it's also an endocrine disruptor and obesogen. And then there's also Gestation, which is a naturally occurring phytoestrogen. It's just natural, and it also is an endocrine disruptor. There are also other man-made chemicals, such as phthalates from plasticizers, the pesticides, which although banned, are still in our ecosystem, and pregnant women today still have the metabolite of DDT in their breast milk. They have DDE in their breast milk. And persistent organic pollutants, many of these had half-lives of like 10 years, and they are still in the sediment in rivers where we fish, and in the animals and the birds that live in those ecosystems, and in the food supply as well. Also, there are other pharmaceutical agents that were very effective in the treatment of diabetes, and one of them is thiazolidinedione, which did a very good job in controlling glucose levels in diabetics. But unfortunately, it was also an obesogen, and so it led to weight accumulation for these people, and so in the end it was not satisfactory.
Great. We have another question here from Farther Kaufman. Does natural gas obtained through fracking have a higher concentration of radon than natural gas from conventional processes?
Well, it really depends on where it's coming from. Conventional processes are generally referring to vertical drilling, and vertical drilling may be done in the exact same area where horizontal drilling is, geographically speaking, but it will bring up overall less quantity of gas. And so, but that quantity of gas will still contain high concentrations of radon if it comes from the Marcellus Shale area. But it's a very good question that you asked, because other shale plays throughout the United States, like for instance down along the Gulf Coast, do not have as much radon mixed in with their natural gas. And so that's the first thing. They have less radon gas to begin with, and then when that natural gas is piped through pipeline systems to us up here in New York State, it's in the pipeline system for a longer transit period, and so it actually has an opportunity to undergo several more decay half-lives for radon. But there's still the decay products, including polonium. But we have been receiving our gas all along from the Louisiana and Texas area, which had a certain amount of radon, but not a large amount. Now, what's going to be happening if we start getting gas pumped into us from Marcellus is that they will be, the industry calls it commingling. They will be commingling the Marcellus natural gas with the southern or Gulf natural gas in a common pipeline. And when the two gases commingle, what they hope is that the higher dose Marcellus natural gas, the high radon, will become diluted by the low dose radon from the southern gas. But the problem is that the reverse will also happen. The high dose, high radon in the Marcellus shale will also increase the amount of radon in the low dose southern natural gas. So no matter how you look at it, people in New York State who are getting natural gas that includes some portion of Marcellus gas will be getting more radon in their natural gas than they have up until now.
Great. And Dr. Bushkin, we have another question here. The question is, when I have my water well tested for toxins, can I test for radon?
Yes, it can be tested for radon as well.
And they have another question here. What are normal levels in the state of New York, varying from county to county, for radon?
That's a very good question. I can tell you that off the top of my head, what I recall is that in New York City, the counties or the boroughs of Brooklyn, Queens, Bronx, all of those have approximately 1.3 picocuries per liter. And the counties of Nassau County on Long Island has about 1.3, and Suffolk has about a low level of 2, like 2.08 or something like that. Then the northeastern regions, like Clinton County and Franklin County, also have very low levels in the range of 1.3 or so. And that is because these counties are very far away from the Marcellus Shale. But when you get to the counties along the southern tier, Broome County, Delaware County, Chemung, Tioga, Cattaraugus, and several others in that region, the numbers are just shocking because they exceed 4 picocuries per liter, which is the EPA's ultimate top level. If the EPA sees 4, they absolutely recommend that you must have corrective action. And the people living in that region of the southern tier and the central counties, they go up. In Cortland County, for example, it's like 14.8 is what naturally coming up out of the ground. And I think in Steuben County, it's something like 12.8 or 12.4. I don't remember all the other counties, but I do remember those. And that reflects exactly what we know to be true about the high level of radon gas in the Marcellus Shale. And as a matter of fact, something else of great interest is that when the industry, the gas and oil industry, does exploration of the region for where's the best place to do the drilling, they use Geiger counters to find out where the most radioactivity is. Because the radon is not there by itself, it's also there, mixed in with radon and uranium. So all these things contribute to the noise that they get on the Geiger counter. And when their Geiger counter starts singing, they know that they are directly over a place that has high levels of naturally occurring radioactive materials.
We have another question. There are instances in which wastewater, produced water from fracking operations, is spread on roads for dust control and for melting ice. Do you have any thoughts as to the risk from normally occurring radioactive materials that are associated with such waste?
Absolutely. This is a very dangerous procedure. And I know that it's done, but there should be at least a regulation to prevent that. That's very dangerous, and what it does is it distributes it all over roads, obviously to de-ice them, and then people drive along these roads. Their car tires pick up the material from the ground and take it into other areas. They could be on their way home from work and driving through it and heading into their own garage, bringing this material right into their home, into their own garage, and walking it into the house. So the spreading of this material for the brine effect, the reason that they spread it is not because of the radon, but because of the brine. They think that the brine is salty enough to reduce the iciness of the roads, but it just doesn't make sense because they are also distributing other chemicals along with it, very dangerous chemicals and radioactivity.
The next question is, what exactly is epigenetics and how does that relate to hydraulic fracturing?
Epigenetics basically refers to processes which influence gene expression. So genetics, as everybody knows, is kind of what your genes are programmed to do and how they do it. But what outside influences, like environmental toxins or diet or things that you're eating or drinking, what they do not actually change the genes. They don't do anything like that. They just change the expression, whether the gene gets expressed or not. So, for example, a very dangerous example would be if a chemical toxin blocked the expression of natural tumor suppressor genes. Then the tumor suppressor genes wouldn't be able to suppress the tumor, and the tumor would be able to grow.
The next question.
So I guess epigenetics is sort of like an overview. It's kind of like it kind of influences how the genes are expressed.
Our next question is, how often should a home be tested for radon? Any thoughts about that?
That's a good question, and I don't really have an answer for it. One thing I'll say is that in the winter is the best time to do it, because in the winter homes are usually closed up because it's very cold. There are some radiological scientists out in the world that say, air exchanges generally clean out the house by 70%. But anybody who lives up here in Albany or upstate New York knows that they don't leave their windows and their doors open long enough in the wintertime to get a 70% exchange of indoor air for outdoor air. So the winter time is the best time to test for it, to find out how much is accumulating within the closed house.
Another question here. The person says, I would expect current consumption rates of sugar in the U.S., which are much higher than those recommended by WRI, to be much more or less a contributing factor to obesity and diabetes and chemical exposures?
That's a very good point. And it's a point that is hotly contested all over the place. It makes all the sense in the world to say that the basic reason for obesity is too many calories in, and that means sugar, as well as other calories, and not enough calories burned off. That's the basic central dogma that we've all learned and believe in, and there is truth to it, and there continues to be truth to it. However, the degree of obesity that we are seeing today has changed so remarkably in just 20 or 30 years that we know that there's something more going on than just eating too much sugar or too many Milky Ways, which that's my favorite. And so we know that there are other things that are interfering. You may know people who are very thin and can eat anything they want. They eat candy, ice cream, they eat everything, and they don't seem to gain weight. And then there are other people who seriously try to lose weight and who actually do when they're on a very, very, very serious and limiting diet. But then they seem to lose the battle and the weight comes back. And during the period of trying to lose the weight, they are really not in homeostasis. They are hungry all the time. They are irritable. They just don't feel good. So the question is, how do we get to homeostasis? And whatever happened to homeostasis? Homeostasis is about having a set point that tells you when you've had enough or when you need more. And what we believe is that chemicals in the environment have changed the set points for large numbers of people, for a large population of people, and that this information carried through endocrine disrupting chemicals can be transferred not only well to the person who's eating the food, but or being exposed to the EDCs, but also through many generations, through multiple generations or transgenerations. And I think multiple generations means through to the grandchildren, and transgenerational go beyond grandchildren. So when you have changes like that that are not due to a mutation in the genes, they are due to something controlling the genes and causing the set point for satiety and hunger to be different, then it's more than just eating too much sugar, taking in too many calories, and not working it off hard enough.
We have one more question here, which is, how do you feel we should be directing our research, and what sort of research should we be focusing on concerning hydraulic fracturing and chronic diseases and cancer?
Well, very much research is needed in from all the different aspects of fracking, including the chemicals and the radioactive materials. It is true, I will say it again, there's much we do not know yet about fracking and assorted chemicals. And the problem is that no industry in history has ever dumped that much of a chemical load into the environment as fracking is able to do. So we're dealing with a world in which we live today in which chemicals are integral to our lives, and that's from past history. But those industries didn't contribute to the environment as much as fracking is planned to do. Millions of gallons of water are used in fracking, and thousands and tens of thousands of gallons of chemicals are used and either injected under the well site, injected into the ground, where there's no way to be certain it will stay where it's injected, where it may very easily seep through normal little fissures in the ground and find its way into the aquifers and add to the water pollution that we have. And the fact that we take so much, millions of gallons of water to get a fracking job done, that is water consumed, not able to be fully cleaned in a wastewater treatment center, and therefore not really fully able to be used for drinking water in the future. So we are first depleting one of our most important resources, water. We are further filthying up another resource, which is our air, and human beings and animals cannot survive without clean water and air to breathe. And in addition to that, we are adding enormously, in an unprecedented magnitude, to the load of chemicals being dumped into our environment. And you asked about research. What research? Well, we have to, I guess we have to do, we have to break it down into different kinds of individual research programs. Right now, as far as obesity and the metabolic syndrome is concerned, and diabetes, a lot of research is coming out and indicating to us differences, for example, in the way visceral fat inside the abdomen has a greater tendency to create diabetes, and hyperglycemia. And subcutaneous fat depots have more of a likelihood to develop hyperleptinemia, which then leads to hyperleptinemia. Well, leptin is generally considered a good hormone. Leptin is the hormone that makes us have satiety. It tells us when enough is enough. But if we have a lot of subcutaneous fat, what we are doing is producing a lot of leptin from those fat cells. And then what happens is the body becomes less sensitive to the leptin. So we begin to lose that benefit of being told when enough is enough. So we get hyperleptinemia, and then we get leptin resistance, and then we get continued obesity. So research like this has to go on so that we can not only identify the pathways causing the diseases, but also begin to find ways to block these pathways and to make people healthy. And I should just end on a sad note. By 2020, it is expected that 86% of the population will be at least overweight.
Great, thank you.
Thank you.
Thank you, Dr. Bushkin. So thank you to everyone for your excellent questions. And if you have further questions for Dr. Bushkin, please feel free to reach out to her or send those to me, and I'll be sure that she gets those questions, and we'll get your questions answered. So we will now wrap up. For those of you who have registered, we will see you next week. Next week we'll be joined by Dr. Lisa McKenzie. Dr. McKenzie will be talking about birth outcomes and maternal residential proximity to natural gas development in rural Colorado. Dr. McKenzie's research has contributed to the understanding of how air pollutants and other exposures affect the health of people living in natural gas development areas. So she'll be talking about her findings in her most recent study, where she assessed birth outcomes and proximity to natural gas development regions in Colorado. So we hope to see you guys there next week. And for those of you who still would like to register, please email me or go to the Eventbrite page and do that. We will be sending out a survey again, as we have before. We appreciate people's responses to continue to improve what we do. So please take a few minutes to complete that. And otherwise, just email me and let me know if you have any questions. And we look forward to seeing you all next week. So have a wonderful rest of your week and rest of your day. Take care. Bye.
Thank you very much.